Hello, I'm Ted Michaels. When I mention anxiety or depression, what do you think of? Do you get a little uncomfortable? You don't want to talk about it? Or you think, hey, maybe you know what? Just suck it up? You're going to meet a specialist who will tell you that there's reasons why people suffer from anxiety and depression, and most importantly, there is help.
We've always asked people whether they're depressed or anxious because we can't do a brain scan, we can't do a blood test or anything else. And so it may be that because stigma is very slowly decreasing, people are willing to tell us more and more about what's really going on for them. We can clearly characterize what depression and anxiety are, but their source, the source of it is really under debate. We certainly know that medications, for instance, that affect serotonin and serotonin levels seem to help mood and anxiety. And so it seems like it would make sense if that meant that depression and anxiety were due to an absence or not enough serotonin. But that hypothesis hasn't worked out. So we actually don't know the exact mechanism of effect of these drugs, but we do know that they very clearly work. There are talking treatments that are just as good for these problems as medications, equally effective. Each treatment has different pros and cons. Medications are relatively easy to take. You just remember to take the pill according to the instructions. Therapy sometimes can be a good way, but it can be difficult for people to confront things and come in and talk about things. It'll take up more of your time. We are all vulnerable to these illnesses, and the more stressors that we have, and the bigger those stressors are, the more vulnerable we all become. But any of us can be depressed, any of us can be anxious under the right circumstances.
For more information on Mind Matters, make sure you keep listening to AM 900 CHML and watch on 900CHML.com. And most importantly, if you have any questions at all about mental health issues, contact stjoes.ca.